What's up, everyone? I'm Janine. I'm a physical therapist, and I help future physical therapists get accepted into physical therapy school without having the extra stress, time, and energy. And today, I wanted to actually sit down with you guys a little bit longer because I know a lot of you follow me on TikTok, and I post a lot of shorter videos on my tips and tricks and everything that you can use to apply to your life. But I actually get a lot of questions in my DMs constantly from students, and a lot of the questions are the same. So I wanted to spend a little bit more time sitting down with you guys to answer some questions that you guys ask me, and also for you to kind of get to know me a little bit more in a longer form. You guys can follow along and go from there. And if you like this video, let me know. Please like and comment, subscribe to my YouTube channel, and also give me some feedback on some future questions that you guys would like to know in the future. So I want to start off by saying now a little bit about me. I went to Stony Brook University for physical therapy school. I graduated in May of 2021, and at first, as a new grad, I started doing travel PT, and I did that for about 2.5 years. It was super, super amazing experience. I got a lot of new friends. I got to experience different places and different settings, and not to mention, I feel like with travel PT, yes, you do get thrown in a little bit, but a lot of the contracts that I did, they kind of knew that I was a new grad, so they did give me a little bit of extra wiggle room there. And assistance if I needed. But in a way, being thrown into those experiences really made me a stronger clinician. And now I feel 4 years out of school, I feel so confident in my abilities. And even just little things like, for example, when our EMR system gets gets updated and it's completely different, I can adapt to that way quicker than my colleagues because I was used to having to adapt to new EMR systems. So I can make a whole new video on that whole topic, but today I want to get a little bit more deeper into some specific questions that you guys have for me. So I have them all on my laptop here. I want to get into the first one, which is, what are the academic qualifications for this career? So typically, in order to get it to practice, so we'll break it down. So we'll break it down into what you need to get into, what academic qualifications you need to get accepted into physical therapy school, and then what you actually need to practice. So in order to get into physical therapy school, you do need a bachelor's degree. It doesn't have to be exercise science. That is a common one, but it can be in anything as long as you have, which is number 2, all of the prerequisite classes that are required for application. So that's going to be your Chem 1 and 2, Psychology 1 and 2, Physics 1 and 2, Statistics, Anatomy 1 and 2, really, and there can be a couple variations here, but that's typically the big ones. And as long as you get those, then you can apply. Then they also do require, some of them require the GRE, but after COVID, not all of them require the GRE. They all typically require at least 2 letters of recommendation. One of them usually should be from a physical therapist, a licensed physical therapist. And then they also require several observation hours. So this can also vary depending on the school. Some schools require a set number, some schools don't. Some schools require one of the experiences to be an inpatient and one to be an outpatient. Some schools don't. So my biggest piece of advice for you is to go and start researching prospective schools that you want to apply to. Look on their websites for their admission requirements and make sure that you're understanding what that school specifically needs so you can set yourself up for success. You can choose to, create a document or whatever, because sometimes these can vary, but I would say, as a rule of thumb, people always ask me, how many observation hours should I get? And I don't think you necessarily need to have thousands of them, but sometimes that is the case, because sometimes people have a job as a tech all throughout undergrad or whatever, and then they accumulate 4,000, 2,000 plus hours. Well, I think that can be fine. I don't think you need to do that in order to get accepted. And I think that I would say if you don't have that, I would argue that a variety in experiences would be probably better. So meaning you have different experiences in different settings. So we have the inpatient setting, We have outpatient, we have pediatrics, we have specializations of those settings, so like cardio rehab for inpatient and outpatient. We have neuro, even pediatrics. We have then the skilled nursing facilities. There's so many out there. There's home health. And so getting at least one inpatient, one outpatient, and then going from there would be really helpful to help you stand out from other applicants. The next question is, why did you choose this profession? So for me personally, it started with my grandparents. When I was in high school, all of my grandparents started to go through physical therapy, and I noticed how their therapists were actually there for them more than the doctors and whatever. And sometimes when my family couldn't actually be there physically in person, I knew that those people were actually cared about my grandparents, and that meant a lot to me. And I was like, wow, I didn't know that was the case. It was so cool. So it started to spike my interest in the career. And then I also have been an athlete and been super into fitness and feeling good about my body. And so I realized then that there are so many other opportunities to help people in physical therapy, not just older people, but other people. And then from there, the rest is history. So the next question is, give me a sample of what your day consists of. So you guys, I want to I don't have the traditional career right now. When I was a travel PT, what that might look like is, so when I worked in Naples, Florida, it was in a general outpatient. It was actually in a balance facility. They did focus on balance, but they also focused on a lot of other, like general orthopedics, I would say. And we saw one patient every 40 minutes. And so each patient was one-on-one, which was great. And 40 minutes goes by pretty fast. So I would typically see about 6 patients before lunch and 6 patients after lunch. And if someone canceled, then I would have that 40 minutes free. What we would do, which was great, was we would all walk around with our laptops on a little rolly desk and kind of type things while we're standing there with our patient and instructing them through exercises. We would see anything from, people that came in with different neurological disorders, like Parkinson's disease, or they had a stroke, or they had a shoulder pain, general orthopedics. So a lot of people had pickleball injuries, or it was really, really cool, and I really enjoyed that aspect. Now, working in a different type of setting, also general orthopedics, outpatient, we did see 2 people an hour. So it was more variety of people. My youngest person was 11 years old. My oldest person was in their hundreds. So there was quite the variety here, and had a lot of high school students. So it would just depend, and we had an hour with each patient. So, you learn how to time manage. You put someone on the bike while you're doing manual on another person, or you give them exercises. And the clinic is small, so you can watch your patients. But although that is not ideal, my schedule now, my typical day is I do one day in the office, a 10-hour day. And so that's what that looks like. But on my other days, I see people in their homes, but where I live, there's luxury buildings where there's so many people that live in the same spot. And a lot of these luxury buildings have gyms, and they have different facilities that we can use as, physical therapists. So I actually tend to have, I have this one big living facility. It's got like townhomes. It has 3 different apartment buildings that have, 21 floors. And I see about like 8 people in this building right now at this time. I've seen more, but some of them leave, some of them get better, and so a lot of them refer me to their friends, and I get more clients that way. So I'll typically show up, like I have one patient in an hour, and so I'll show up. We'll either meet at the gym, or I'll go to their house. I'll walk them through exercises one-on-one. It's super. People tend to feel really comfortable in their own homes, which is great. And then I'll either, if they're in the same building, I'll take the elevator down to my next patient, or I'll walk across the street to the next patient, see a couple patients, and then the rest of my days spent doing admin, working on my business, my different businesses. Also, making sure I do my notes. For that I do notes on my phone. It's pretty quick and easy. And then just making sure I follow up with my patients and confirm the next times of their day. And then doing some work for my other adventures. So did I ever do an internship? If so, did you recommend it? I mean, we did observation hours, which is required to apply to PT school, but I never. And then once you're in PT school, you have to do your clinical rotations. There's 3 to 4 of them, and this is required for everything. So I'm not sure in terms of additional internships on top of that, I did want to learn about business and marketing, so I did do an internship with a marketing firm to learn about this, where they were consulting businesses, they were creating marketing materials for different medical businesses, like dental offices and whatnot. And I actually learned a lot there. And if you want to pursue anything in business or doing your own thing, I highly recommend doing that as well. But you can also nowadays, there's so many things online. That was like 2018. There's so many things online that you can just learn from online. What is the salary range? So I never really had I can't really speak on a salary as a full-time therapist because I've never really been a full-time therapist. I've only done travel PT and then worked per diem and then worked contracted work and now my own work as well. So what I used to make as a travel PT was nothing less than $1,500 a week, usually more than that, closer to $2,000 a week, and that was after taxes. So a big part of your income as a travel PT is considered a stipend, which is non-taxable income, and so that's great. So typically you're paid like a per hour rate, which is like really low, like $16 an hour, and that's what you can get taxed on, and then the rest of it you don't get taxed on. So when it comes time to file your annual taxes, you are only really reporting on that $16 per hour, so it's actually looks like you made like $20,000 a year, which is not what you made. You made way more. You can do the math. I also, between travel contracts, sometimes I would take like a month off at a time. So it's hard to say really what you make in 1 year because it just depends on how much you decide to work or not work. And then, as a contracted, when I go to see my own patients, I don't really charge people less than $70 an hour, more close to $100 an hour, because I do see people in their own homes and they refer me to their friends. I give them a little bit of a discount there, and because I don't have to travel, I don't have to spend 30 minutes going here and then here and here. I can bang 4 to 5 patients out in 4 to 5 hours and then be done with my day. And then as a per diem physical therapist, I've gotten $50 an hour or more than that. But nothing less than $50 an hour. Okay. How does one get to where you are now? So I love this question. I think you just have to, my biggest thing is that you just have to be, you have to take initiative. Don't ever think that, everything is going to come to you. You have to actually go out and seek opportunities. So if you want to get into physical therapy school, you got to become a go-getter and you have to go out and seek opportunities. So like I would show up to my professor's office hours and be like, what opportunities do you have for me? Like, and then they would look at my grades and I would have good grades in their class. They'd be like, oh yeah, okay, you could be a tutor or whatever. Or I wanted to be a tutor for anatomy. I actually went to the office where they employ people and I knocked on the door and I was like, hi, I'm Janine. I would love to get this job. And I just introduced myself. I didn't wait for that opportunity to come to me. And then when it comes to now, I've started, I think, doing travel PT really, really helped open my mind to more exposure. And then I also spent a lot of time learning those other things. Like I learned a lot about marketing and I learned a lot about business, and that really helped me when it comes to, seeing my own clients and seeing my patients and building my online platforms. and learning how to market them the proper way and go about all of that. And so I think just be open-minded and never settle, and always try to take initiative and better yourself. Okay, what are the personal skills and abilities you will need in order to succeed? Great question. So I think one is discipline. So I think that discipline is really important, and even if it's just creating little habits here and there, discipline over time, even if it's a little bit of discipline each day, it's going to stack on top of it and build momentum. And so having discipline, also, being empathetic, I think, is the biggest thing when it comes to physical therapy specifically. I remember being told once that I wasn't sadistic enough to be a physical therapist, but now that I've worked with so many different people, me having more of a gentle approach sometimes works really, really well with people. I've had people tell me that they worked with other physical therapists or other trainers that just tried to push them too hard and they never listened to them. Whereas, like, if you actually sit down and listen to their pain and listen to all the other things that go into their injuries, like their psychology and their emotions and their day-to-day problems, that also contributes. So being open-minded about that and being empathetic is really going to help you stand out from other applicants, and then other applicants and other physical therapists. And I think discipline, empathy, and just confidence and believing in yourself. And I really don't think that confidence is something that is, you either have it or you don't. I think that we have to constantly be working on it every single day and trying to build up our confidence every day. What is the most rewarding part of my job? Oh, I think it's definitely building connections with people and really helping them through something. So, like, for example, I had this girl come in to me with neck pain with ridiculous symptoms down her hand, and she did not think that physical therapy was going to do anything for her, and she was experiencing depression because her father just passed away, and then she was dealing with this, and they told her basically she was going to need surgery, but to try physical therapy first. She didn't believe in it. She came in, I dug into her neck, and I made her symptoms go away like that. And she actually, to the point where she started bawling her eyes out. She was like, wow, I didn't think that anything would help me. I've been going through so much pain for so long. And it was like, wow, I just made that little difference in someone's life. And that's so cool. So little things like that. And then also, these people end up becoming like family to you. You joke around with them, you laugh with them, you talk about your weekend with them and your families and your life, and it's a really, really cool feeling. Okay, the worst part about my job, I think, can definitely be burnout. I'm not gonna lie. I think when you work for a corporation that is kind of ruled with insurance, they ruled by insurance, they kind of force you to see, not force you, but they push you to see more patients and this and that can be exhausting. And then also sometimes people can be really mean, okay? Even though you're trying to help them, sometimes people can be rude. And now that I've had a little bit of experience, I don't even stress about it. When I was a new grad, I was a little bit, that would really get to me when people were mean or rude. But now it doesn't bother me, but that can be stressful and overwhelming. And sometimes when you have a long day, and you don't have to have a long day, it's up to you, but I choose to do a day where it's like a 12-hour day in the office. By the time I get home, I'm physically, mentally, and emotionally exhausted. But that doesn't have to be the case all the time. But yeah. What would I have done differently along the way? Honestly, nothing. Absolutely nothing. If anything, actually, that's wrong. I wouldn't have stressed so hard. I feel like I put a lot of pressure on myself, which can be a good thing, but I think that looking back, going through the application process of applying to physical therapy school, it really doesn't have to be so stressful. And there was no one like me when I was applying to school. There was no one guiding me through this process. So I think that's a really cool thing that I can give back to people now, that I wish I would have been able to listen to someone like me helping you through this process, because it was a lot of unknowns and a lot of scary comparisons and thoughts and emotions, and so I just probably would have tried not to stress as much. And yeah. Okay, what advice would I give to someone who is trying to pursue this career? So I'll break this up into how to get into physical therapy school. And you guys, I'm actually going to be going over exactly all of my tips and advice on how to get into physical therapy school at my free PT School Acceptance Masterclass on July 26th at 1 p.m. Eastern Time. I'm going over, basically, there's 3 main things that you need to know. Learning how to master your GPA, so learning how to be an effective studier so you're not spending so much time studying, but you can actually still get good grades, bang out a really effective study session, and then free up your time in your schedule to do other things, which is number 2, is getting involved in experiences that are related to the physical therapy field and also are not related to the physical therapy field. And I'm going over exactly what that would look like at my free webinar masterclass, so make sure you come. And then the last thing is learning how to make your application work for you. There's so much strategy in this, and especially when it comes to like your supplemental material and your interview and filling out your application, you can actually make it work for you and have it do work back for you because you've already put in a lot of work. So I'm going over that as well at my masterclass. You guys don't want to miss it. I'm also giving away a lot of free things like my free PDF document scholarship list with so many grants and scholarships. I know tuition and cost of everything can be very overwhelming and stressful. So that's why I created that document. So you guys, there are so many opportunities out there, you just don't even know. So I'm giving that away at my free masterclass. Make sure you come, only for the people who actually show up, and a couple other bonus things as well for the people who actually show up. And then, so yeah, you guys, please, it's going to be insanely knowledgeable. Things that I can't even get, I want to get into it right now, but like this video is already pretty long, so I'm not going to do that. And then, yeah, I think when it comes to pursuing this field, I think is just have empathy and compassion. And if you want to avoid burnout, just make sure you have an open mind, and know that there's so many opportunities out there for you to, one, not only make more money, but to have a more work-life balance where you're actually still helping people and you're still making a difference in their lives, but you're not burnt out doing it and you have more time to enjoy your life as well. So you guys, I really hope, I'm going to be doing a part 2 to this video, so make sure you subscribe and stay tuned for that video. I really hope you like this. Let me know in the comment section what you think. If you have any questions that you want me to answer in the future, make sure you just sign up for my free masterclass, and yeah, I will catch you guys in the next one.